most challenges in healthcare today aren't really CMS or tech problems per se, but they are governance problems. Who owns what? Who's making the decisions?
There is this pull even more, I think, towards treating the platform decision like it is the strategy, but the platform can't solve the cross-functional problem.
IT is usually, a department that dwarfs marketing and that depending on the organization is going to cover a lot, right? Or
Mhm.
a bit less, but like it can go into like, everything digital and all the IT and tools and whatever that the organization is using. So oftentimes the portion that's the initial patient experience, the website is kind of like, oh, it's just like a rounding error for them. They're like, whatever, like I don't have time for this.
I'm a big believer in shared ownership between marketing and IT. So equal
Okay.
weight in decisions, shared budget for MarTech, I think there should be. So I think part of the challenge too is decisions get made where budget lives.
You're going to have some physician who's going to say, hey, when I'm searching my name, I don't appear on the search results correctly. And then we're going to allocate a bunch of time and effort on that. And when that should not have been prioritized, just having that form is going to dissuade a bunch of these random requests. And
Yes.
that kind of removes 30 to 40% of those, finally
Yeah.
wasn't that important. Hi, everyone, and welcome back to the Healthcare Marketing Playbook podcast. I'm Brad, CEO of Symetris, digital agency that helps healthcare organizations really extract more value from their website, from the redesigns to ongoing maintenance and evolution. We work with hospitals and health systems. And today we are going to be talking about cross-functional digital governance and specifically how to make things deliver through all the people and politics that are involved. Because most challenges in healthcare today aren't really CMS or tech problems per se, but they are governance problems. Who owns what? Who's making the decisions? How do marketing and IT and digital and access and even the vendors, how do they all work together to actually achieve a result together? So it's not so much about theory today, but practically how we're going to be implementing this inside healthcare organizations. And the person I felt was the most valuable to give some insight on this subject was Teresa Lockamy. And she has spent over a decade working with marketing and digital programs at major academic medical centers, including Johns Hopkins Medicine and Mass General Brigham. And over the past year, she has taken that experience and founded Inner Path Digital. And that's where she's now helping health systems to build those digital programs and make them work, and not just from a technology standpoint, but from the people and the process and the governance. And what I think is really valuable for Teresa in this conversation is that she has been on the inside and she has lived that complexity. She's seen those politics, the silos, and now she's helping the organizations from the outside and helping them inside to untangle all this and actually deliver. So I'm really looking forward to this practical conversation, and welcome to the podcast, Teresa.
Thank you so much, Brad. I'm so excited to be here and so excited to talk about this topic, right? Like I do feel like it's coming up more and more, but it's still in my mind not talked about enough, right? And to your point, like working at two large AMCs with a lot of complexities and then working across AMCs and regional health systems now and supporting them, you consistently see the same struggle, right? I mean, teams are trying to move work forward overall, but digital work, especially, it gets stuck. It has more interdependencies. Tools shift, platforms evolve, right? And to the point that you made, there's a lot of focus and emphasis that's placed on the actual tools,
Right.
right?
Yeah.
And regardless of the tool set, the organizational friction that I've seen stays pretty consistent. So a lot of my work sits in the middle of marketing, IT, clinical, ops, analytics, the vendors, right, that are supporting. And everyone in the mix has good intentions, right? And they're trying to move this work forward. But the question is how do we get over this hump from intentions to outcomes? And for me, a lot of that comes down to what we're going to talk about today, right? Governance, workflows, process, things of that sort.
Yeah, 100% agree. And I think that, the fact that you were mentioning you work at AMCs, right? And there's that additional layer because there's the research and then there's also the physicians and the brand notoriety in the medical field as well, and not just for patients. So there's so many stakeholders Like I'm sure you've seen so many people wanting to tug in their own direction that carpet. So I'm really looking forward to our conversation. From your experience, right, with the from the inside and from seeing it from the outside now, um, where does where does this governance break down, or where it's so crucial, right? That it's you can see that, oh man, this is gonna impact the project that you're working on or whatever. Like, what are those clear signs that you've seen?
Yeah. What is the fail point,
Yeah.
right? I mean, I think governance fails earlier than people think. I
Hmm.
think it starts with clarity, right? So goals, roadmap, objectives, priority, cross functionally, cross departmentally. What I've witnessed and seen is it's truly hard to come up with shared goals across even functions, much less departments.
Okay. Right.
I've seen organizations make effort there, but if we're not starting from the same understanding of what we're trying to achieve longer term, next year, the next 6 months, the next 90 days, everything downstream from there gets messy. And then, even at times when there is high level clarity, let's say, the next problem is how does that translate to your earlier points, right? How does that translate into ownership?
Hmm.
Execution, who's accountable for moving it forward, who are the critical stakeholders? Is this something that's co-owned once we pull out of kind of like a siloed priority into a enterprise or organizational priority? And you see this even within marketing, like even not even just within the marketing
Right.
shop, right? Let's say it's a priority, we need to grow neurosurgery for this year.
Yeah. Okay. Yeah.
That's directionally clear. But then it's who owns the planning, who owns the strategy, who owns the execution,
Right.
how are decisions getting made, and how do we kind of avoid that swirl that becomes really common in healthcare?
So let's say we're saying that was one of the imperatives, let's say, for the years. Let's have more surgery booked. So where does that, from your experience, where does that message come from? Is it something that, I'm guessing it's not something that bubbles from the bottom up, right? It's something that's set at a very high level, at the CMO level, VP level. Is where does that usually originate from, right? And how is it? What is a good way of communicating it clearly, right? Because you're talking about the clarity. And what are ways that make it unclear and that are kind of setting it up for failure?
Yeah. So I think starting with what are the priorities, and then also what are the tiers, or what is the importance within those priorities? So a big challenge that health systems have is there's so many priorities. You have core priorities, you have things coming at you from across the enterprise, right? You have things that pop up that you weren't
Yeah.
expecting. So how do you define what is critical, what is most important, what can kind of go on the back burner? I think that's important. And just understanding level of effort that should go towards that. And then
Yeah.
to your point, starting with a strategic plan. So that does typically start from leadership. To be honest though, sometimes it doesn't always come down from operational or clinical leadership. Sometimes it's driven at a departmental level,
Uh-huh.
right? It's the department saying this is the priority. So I think that is the challenge and the hard part about working in healthcare, and even more the reason to try to get that clarity at the onset and try to have those templates and templatized ways of working to be
Mhm.
able to drive work forward.
And so in those templates, and you kind of alluded to some elements there where, there's an element of, okay, so let's say we want to increase the amount of surgeries that we're doing this year. Now, from my experience, that's not very clear, right? So yeah, it kind of gives some kind of a direction, but it says it doesn't, as you said, it doesn't position
Mhm.
it compared to other initiatives, right? As you said, there's a bunch of them. We're
Yes.
not scoping it in the sense where we're able to put this much effort into it or this much budget into it, or percentage wise or hours or dollars, right? And then we also don't have a clear goal of, like, what does that mean? Is that a 5% increase? Is that a 20% increase? Is that in a specific type of elective surgery, or is it all across the board? So what are those elements that you feel are so important to add into that template, so that every time we have one of these initiatives or priorities, that we have that clarity around it?
Yeah. So I think everything should start either depending. So right now we're talking about service line priorities. So staying with that thought, it would be a little bit different if we're working cross departmentally on like a MarTech project, right? But I think starting with a charter and starting with understanding what is the why, what are we trying to achieve, who's involved, like what are the higher level objectives, and then having that strategic brief that has what are the specific goals, what are the subspecialties we're targeting, what is the weight of priority. I think that there is a reality that not every health system is always going to have the specific level of goals that you just talked about that would be ideal to be able to have in a plan, right?
Right.
But even understanding this is a specific subspecialty, we're trying to increase these surgeries, and then being able to understand what does the market look like? What are the personas look like, right? What are the high propensity kind of audiences that we should be targeting? And to have that base level, what is the competitive landscape?
Hmm.
I could go on, but what is that foundational information in the strategic brief that then enables the cross functional leads and experts, the subject matter experts, whether that's for search or marketing automation, et cetera, to be able to come in and all be marching towards the same place to be able to build an integrated plan.
Okay, right. Then I think that's really helpful for the individuals who are going to be working on this. And so we got that ideally that level of clarity. And then we're saying, okay, well, a portion of that is going to be, as you said, social, or some is going to be content, and some is going to be. And I'm always like a bit more involved on the website side of things, but how do we know like how, who's owning this, and how does that compared to the everyday kind of last minute requests and emergencies and things that always pop up, right? That are just a constant flow of requests of this, of that, right? And then we also have this priority. How do we manage stuff that is kind of feels urgent but not as important, right? Versus this kind of longer term type of initiative, which is important and urgent, but sometimes stuff gets in the way, or the little sand gets into instead of working on the big rocks. Do you have any tips on fielding all those different requests that people are going to be getting and allocating our energy on one initiative or another?
Yes. Yeah. So you're talking about the execution layer, right? I mean, ultimately, what we're talking about a high level, right,
Right.
is building a model that increases operational efficiency and readiness. And I underscore that first because sometimes in situations we get so focused on the execution layer that we're missing
Right.
what we're laddering up to.
Yep.
But to your point, for how work gets done and how to identify who's doing what and to be able to divide and conquer, I think that's where pods or working groups can come into place, right? Or you've heard them called tiger teams. I think there's another name that I'm blanking on that you've heard them called. But really, the idea is just a working group with a shared outcome. They're
Right.
time bound, they're purpose driven, people are clear on their role. Again, that kind of starts before there's a strategic brief, right? In the charter, we're identifying who's on this, what pod members are on this. And there's a factor where they're semi-dedicated to an area as well. So they're not constantly rebooting, right? Every time something new comes up. And to make that work, to your point, you do need the clear roles, right? Who owns what pieces of it. I want to touch on the enterprise piece versus, let's say, strategic priorities. So, in an ideal world, if you have enough resources,
Right.
and that can be internal and external, right? Leaning on contractor
Yep.
support as well. You can have pods that are targeted to a specific area. So a pod may be targeted to heart and
Hmm.
vascular. AFib could be part of that. Let's say transplant could also be in that bucket, and that's one pod. And then you have other pods that are targeted to other service line portfolios.
Right.
And then you have an enterprise pod. And that pod is focused on the requests that are coming in.
Oh, interesting.
Now, that pod could be its own pod that's not in the other pods,
Right. Right. Right.
but it also could be members that are in other pods, but maybe they're in tier 2 work or tier 3 work for the other pods. So they have more bandwidth, but then they're able to assess, do discovery, and then within some type of meeting that brings leaders together to be able to have a discussion around this is what we're working on, this is what's come in. Are we moving forward to this? Does this need to be redirected? So, that kind of operating cadence, that meeting to support decisions is important as well. And then I'll just mention one more point. Sorry, just clear visibility as well.
Yeah.
And from an intake perspective. So, there needs to be clear intake, logic based intake that people can see, that they can report on
Well,
as
sorry,
well.
just to be clear, what do you mean by intake?
So, how is information coming in? So,
Right.
for a strategic priority, it may come in through the creation of a charter and a strategic brief that gets built into an integrated plan, gets built into a project plan for something that's coming from across the enterprise that
Yeah.
may come in through a form that Department of Radiology wants to
Right.
build a new page on their site. So just having that clear intake that then feeds into a project management system.
Okay, right, right. I get it. And I really like the idea of the pods. We internally at Symetris, we use a similar approach where we do have people that are more assigned to specific projects. Some people are assigned to
Exactly.
evolution and improvements on existing platforms that we're working on. And we also have
Mhm.
a dedicated quote unquote maintenance team, which kind of feels like your enterprise team, which is more like internal and kind of these quick fixes and stuff that comes in, right? Which is just
Yep.
a normal flow of stuff, but it's not necessarily connected to a strategic initiative. And what I've seen when there is not clear governance, as you're mentioning, is that over a year, we're going to create this kind of great plan of what we're going to be accomplishing. But then what happens is that the day to day gets consumed by all these very operational day to day items. And so we plan on spending, let's say, 70% of the budget on improvements and 30% on quick fixes and maintenance. And then we end up doing the opposite and spending like 60 to 70% of the budget on these operational items and just 30% on creating real value. And I think that a lot of the reason for that is that governance issue where, you're going to have some physician who's going to say, hey, when I'm searching my name, I don't appear on the search results correctly. And then we're going to allocate a bunch of time and effort on that. And when that should not have been prioritized, but, then there wasn't that governance structure internally set in place, or there's not that form to intake those requests, right? That was
Yep.
was talking with Alan Shoebridge a couple days ago, and he was saying that, just the fact of having that form is going to dissuade a bunch of these random requests. I'm like, oh, yeah, that's a great request. Fill in the form and be clear on
Sure.
your request. And
Yes.
that kind of removes 30 to 40% of those.
Yeah.
Finally, wasn't that important kind of a
Yes.
request.
Yes. And what it helps to position that a slightly different way, what it helps to do is it helps the person that's submitting to think about a little bit more what they're submitting through that form process, right? To also start to say, oh, maybe I'm not ready to do this, right? If they want to create a social channel, for example, well, submit to us a sample editorial calendar. What's your
Right.
audience? Then they start to realize, oh, wait a minute, maybe I'm not ready to set up my own channel.
Right. And so,
Yeah.
so we've slightly touched on a couple of ideas like that, a template, like the ideas having these meetings to increase the visibility,
Yep.
potentially like dashboards and stuff like that. And I think that when, the idea of talking about governance, even though it's core to so many things, it sounds kind of like theoretical, kind of boring, like, oh, another meeting, right? I got work to
Yeah.
do kind of thing. And
Yes.
so could you tell me about how in practice, right? What does this look like? How does this enhance the day-to-day capacity for teams to deliver and not just be a bloat of meetings and more reporting and more dashboards and just getting lost in all the noise, right? And not seeing the signal, I guess, from the noise.
Yeah.
What does a good approach to governance practically look like in a regular, I guess, week or month?
Yeah. Yeah, that's a great question. And it's such a good point because whenever you're doing, when I've been part of these kind of resets around governance and process, right? It always feels like more, to your
Yeah.
point. It's like more bloat, more meetings, heavier process. But the only reason it feels that way is because it's structured. Because if you really look at where time was going before, you were already in a ton of meetings, right? They were just
Mm.
not structured. They were side conversations. They were, let's reconnect the dots. They were decisions getting revisited and kind of teams feeling frustrated too, because things are just being tossed over the fence. So the structure adds clarity, but whenever you add structure, you can see things more clearly too. So you see the meetings, you see things more.
Right, I love that. That's like a really great way of reframing it. So it's not necessarily adding meetings, it's reallocating that time that you're spending in useless, quote unquote, or
Exactly.
less productive meetings into more valuable, time that you're spending in meetings. Is that what you're saying in a sense?
100%. Yes. Yeah. And you want to be cognizant of not creating more meetings. You want to optimize where you can. So, as an example, when you start a restructuring effort, maybe you have an individual meeting for each service line where you're
Right.
bringing a group together. Then as you're kind of optimized and you're working the way that you should, should be working, for the lack of a better way to say it, then maybe you start having meetings that are portfolio based. So
Right.
it's the same team that's focused on that portfolio, and you have three service lines that's covered in there. So instead of 4 30-minute meetings a week, you have 1 month, is what I
Right.
meant to say.
Right. Right.
You have 1 1 hour meeting a month, right? That's covering all of those areas for
Yeah.
planning. So you want to be cognizant of that. But the whole idea is that once it's streamlined, it's just going to feel like this is how we work, not that this is too many meetings.
One thing that and I just want to kind of maybe double click on that is there are different types of information for different meetings, right? When you're kind of structuring the governance, and there are these more
Mhm.
operational executional meetings, then there are higher
Yep.
level visibility meetings, then there are alignment with strategy, high level in determining that ongoing strategy type of meetings. And one thing that I've seen when people are trying to implement kind of more governance is adding all these meetings and inviting everybody to all these meetings all the time. And when
Yep.
that happens is you very quickly see higher level executives not being interested anymore. And they're basically constantly either canceling or just not showing up to these meetings because it's too much,
Mhm.
too operational, et cetera. But the message that that sends out to the team is that, oh, I'm not interested. This is not important, right? But at this, what we've seen as worked is saying, hey, we have these more,
Mhm.
day-to-day project management sprints type meetings, and then we have every month or so an executive alignment meeting where we're saying, hey, this is the progress we're doing. These are our
Yep.
roadblocks. This is our next steps. And
Yep.
so, have you seen that as well? Like in what has worked, what has not?
Absolutely, right? So you have, I think to your point, there's varying levels of meetings, and leadership does need to be present, and not just present at some of them, but also carrying through the message and reinforcing it outside of the meetings too, to make sure that the broader team knows that this is something that's important and support it. But there's the planning meetings, or where you're going to be going over the kind of strategic brief. And I think having leaders director level there is important. And to your point, as you start to get into the status meetings and things are running, you likely don't need your directors at all of those meetings, right? That can be the team that's carrying out the work,
Right.
and then that's kind of rolling back and reporting up. And then to your point, a critical piece is kind of like the roadmap recalibration, right? What is that quarterly check in that
Right.
looks at what's working, where are we aligned, what do we need to tweak? Are we still moving in the direction that we should?
Yeah.
Yes,
Okay. Yeah.
100%.
100%. And I think part of those setting those different meetings, like the quarterly, the monthly, the kind of weekly, and then there gets to be a certain level of daily, obviously, for the people, boots on the ground.
Yes.
We haven't talked specifically about it, right? But this obviously evokes in my mind the idea of a RACI chart and being very clear on who's responsible, accountable, consulted, informed, etc. It's something that is valuable. A lot of people understand the value of that. It's not always implemented, but then in reality, sometimes people don't refer to it or don't respect that flow, right?
Yeah.
So how do you, like, from your experience, have you gotten people to quote unquote stay in their lane and not say, oh, this is like, we've identified you as just being informed, right? So I'm not expecting you to make decisions on this. So you might have opinions, but that's all nice and great, but you're not part of that part of the process without kind of hurting people's feelings. How have
Mhm.
you helped people
Yeah.
stay kind of, in their lane?
Yeah. So I guess a couple of things. So some of the organizations that I've supported have went through massive transformation and growth, right? So I think if that is the stage of the organization's at, then you usually do need to zoom out and look at roles overall, look at the Venn diagram of what of the overlap
Mm,
between roles, build out role catalogs, build out those RACIs. And RACIs are going to typically be assigned to a specific workflow. It's not
yeah.
like a broader RACI that covers everything, of course, right? So let's say there's a RACI that's developed related to the planning process and that kind of like project life cycle. Then that RACI, so no one has to refer back to the actual spreadsheet or RACI, gets again populated into that charter, which is how every meeting at a kickoff is started. This is what we're doing. This is the work we're doing. These are the roles. This is what they're doing. So I think it's starting there, reinforcing it within the process, and then building those workflows and those roles into your project management tool. So when something comes in that fits that area that that person's focused on. There's automations and it's assigned to them, right? Or the person that's building out the project plan, it's assigned to them. So I think that's one way, starting conceptually and then building it into the actual workflows and processes.
Yeah, I'm a big believer that project management, which, connects with the governance, is so crucial. I love having tools. Not every team has tools. Some of them are still kind of sending each other emails and trying to track stuff with Excels. And I guess that's great, but I feel one of the most valuable investments to be more productive is using these kind of project management tools that can help you, like these Asanas. We use Jira, like every organization can
Exactly.
have different ones. But then there's one thing of having a tool, but then using the tool correctly too, right? Because then if everything is going on through your
Yeah.
team's chat, right, then
Yep.
it's not appearing there. It's useless in a sense. But, that's, I think,
Yeah.
another change
Adoption is the
management thing, right?
challenge. 100%. Yeah.
Delving into this basically a tool, right, or a technology, and we were talking about at the beginning of the conversation, but we didn't delve into it too much because we were talking a lot about the marketing team over the
Yeah.
past conversation. But I'd like to kind of now bubble up to the interactions with the other departments and the other tools, right? So then
Hmm.
there's
Okay.
going to be let's say the website, but that's going to connect, with appointments. That's going to connect with an Epic, right? And then there's the CRM, and then you're going to have people from other departments have points of view on all these different tools and IT and all that. So I think that for me is another subject that I'd really love to kind of pick your brain on what do you feel are approaches and best practices and how teams should approach this kind of cross departmental, but also using multiple tools and how to make those, connect and interact because they're usually different owners for all these different tools.
Yeah. Yeah. To your point, this is where really governance does intersect, right, with MarTech and where it becomes so critical because the patient experience doesn't live in one system, right?
Right.
It lives across scheduling, access, workflows, CRM, marketing automation, et cetera. And this is really where you see those breakdowns because there isn't a shared roadmap or a shared way for marketing, IT, and ops to come together and make decisions across the full journey.
Right.
Looking at the patient, but also the person, right? Everything that happens before they even hit the front door. So I think when digital front door started being talked about a lot,
Yeah.
I heard a lot about committees being formed and teams coming together. And then that kind of dropped off because I don't think it worked in the way that organizations
Right.
were hoping for. And I think some organizations were successful with that. And you see that in the outcomes of their work, I think. But I'm starting to hear it talked about again because, especially as these platforms are expanding, right? So the technology landscape's changing, and some of the
Mm.
major healthcare platforms, not to name names, are expanding what they own,
Yeah. What they
right?
can do. Right. Yeah.
Exactly. There is this pull even more, I think, towards treating the platform decision like it is the strategy, but the platform can't solve the cross functional problem.
Right.
So I think the groups coming together at a leadership level, again, and I think this is where a charter comes into place too. You're working on, let's say, a CRM, a marketing automation project. What are you trying to achieve? Are you doing an implementation that's cross departmentally, right? That's definitely going to be a partnership with IT, likely ops too. What are the roles there? What are we trying to achieve? I think outlining that at the front and then working together on the pieces. So, a very tangible example, if we're implementing or we're optimizing and we're creating user stories for what it is that we're trying to achieve,
Hmm.
let's work on those user stories together. And then those user stories then become technical requirements for to work closely with the IT team to support. So I feel like I'm sounding redundant, but I think it's like coming together right at the start of all of this to align on what it is that we're trying to achieve and then moving forward in a structured way that has clear role, clear ownership, clear deliverables.
Let's say
That's
we're talking about IT specifically, because IT is usually, a department that dwarfs marketing and that depending on the organization is going to cover a lot, right? Or a bit less, but like it can go into like, everything digital and all the IT and tools and whatever that the organization is using. So oftentimes the portion that's the initial patient experience, the website is kind of like, oh, it's just like a rounding error for them. They're like, whatever, like I don't have time for this. And this is what's really important. So how do you get buy-on from these different departments and also not, we're talking about the meetings. So these pods, I like that idea of having a pod and having someone from different departments on those pods. but then they can't be there on those weekly meetings probably because that's too intense. So it'd probably be the monthly ones. But I'm doing a bunch of assumptions here.
Yeah.
What has been from your experience, what's worked and what's not?
Yeah. I mean, I think so. I don't know if you've ever read the book Leading Change. I love that
No, I
book.
haven't.
And it talks about in times of change, which technology is bringing about the need, the consumer demand, and technology, right, is bringing about the need for ongoing change, that there needs to be a guiding coalition, right? So I really do feel like this starts at the CMO level, at the
Right.
VP level, to be able to come together and to say, and again, I've seen this work in organizations where that's happening and these teams are working closely together. And it's not that they don't have different perspectives, but they respect each other's role and they're
Right.
working on a shared plan. And when that's not happening, like that's where things break down. This isn't tangible or practical because I haven't seen it in any organizations. I don't even know if it exists, but I'm a big believer in shared ownership between marketing and IT. So equal
Okay.
weight in decisions, shared budget for MarTech, I think there should be. So I think part of the challenge too is decisions get made where budget lives.
Right.
And a
Right.
lot of times, budget for a lot of the IT platforms lives there. So I think having that shared relationship and partnership at the top is critical.
Hmm.
Then, with that, shared understanding of what is centralized, right? And then what is kind of distributed. So, what is common across the way that IT and marketing are working
Right.
together. So, things like data standards and definitions, privacy, security, and consent guardrails, identity management, right?
Hmm.
Platform architecture, like these things should be shared and defined, I think, in a central way across departments. And then there can be localized approaches to things like campaign exit, things of that sort. I don't know if that answered your question or if that was practical enough, because I think it's still a challenge, a very real challenge. But
Yeah, and I think there's nothing that we're talking about that has like a magical silver bullet, right? Each organization is so different. Just as you were
yes,
saying, like who owns the patient experience? Some organizations have a very strong leadership. Then there's a
yes,
role that's the patient experience who's in charge not only of, stuff regarding marketing, but can get into the overall patient experience when they're living through it, right? And
yes,
there's other organizations that are set up as completely separate the patient experience once they've booked an appointment and they're in the Epic or whatever other system, then it's a completely other group of people that are managing that, and there's a complete silo. So
yes.
there's each organization, I think, is going to need a governance that fits with their culture and the way they're set up, right? And so there are best practices, but there's no magic, wand that we can say, hey, this always works.
Exactly. Yeah. And momentum is important too, right? So focusing on areas where you can achieve quick wins, especially when you're trying to create change is important to your point of aligning with where the organization is at so you can have those quick wins. So it's a great
Absolutely.
point.
This is super interesting, and I wanted to figure out, like, so now that we've kind of set this baseline of what's important in governance and people, process, technology, right? That's the language we speak every day, right?
Yeah.
And so let's say we're looking ahead. How do you think, based on the fact that there's the whole experience as a patient is becoming more digitalized? We recently saw that OpenAI has its whole OpenAI Health now. That people are expecting the healthcare experience to be more digital overall, right? And then there's
Yeah.
AI and all this and all that. How do you think there's an impact overall on how we're going to approach governance moving forward? Are these just kind of like other tools and other realities and changes that good governance is always going to be the same finally, in the sense where we just have to adapt to this reality, but we're not going to adapt how we're going to approach governance? Like, what's your position on that?
I think that good governance and coming together, and again, all the things we talked about, right? Clarity on goals and roadmap, clear roles is going to be able to support any technology implementation, any innovation, right? I think to me, the only thing that the shifts are underscoring is how critical this is to do and how I think that that's where I go back to thinking there should be some element of structural changes within an organization to support this, to say the shared budget, the shared
Mm,
ownership, because I think it's so critical right now that even at the C-suite level, right, the idea of governance and coming together across departments to achieve a common vision needs to be supported, and I want to use the word enforced, although I feel like that's a strong word, but
Right, right, right. But I agree that it has to permeate, right, the rest of the organization. And I really do feel that the more change there is going on, the more important governance
yes.
becomes, right? And if you're not, don't have that, you're going to really fall behind as a system or as a hospital or whatever, in the sense where if the governance is there, you're going to be able to seize the opportunities as they are. You're going to be able to do those pilot projects, test stuff out, and have everybody align on that and have less quote unquote waste
Yep.
and friction, which often is that's what bad governance, that's the
Yep.
effect of it, right?
Yep.
And so it's kind of imperative in this world that it's changing like at blazing speed. Like it seems every year gets faster.
Yeah.
Governance is so important.
Yes. 100%.
So, so having said that, what do you feel are just kind of in closing, if I'm an organization and I don't know, I'm a director of marketing, a VP of marketing, or any other aspect there, what should be, if I want to improve on, hey, you know what, this governance thing is really important. We've done some efforts, but
Mhm.
I'd love to kind of be ahead of the pack and be able to set this structure up internally. What do you think are tangible things that a team or a leader in a healthcare organization can focus on or put in place over the next, I don't know, couple of days, weeks? Like, what should they be prioritizing?
Yeah. I mean, I think it starts with them kind of asking questions of themselves, right? So
Okay.
just clarifying, do we have a common definition of what the consumer experience roadmap is for the next 2 to 3 years? Like, is that something that we feel like we have as an organization? And if we do have that, right, our marketing, IT, ops, clinical, are they aligned on it? Or do we need to start to bring people together to start to talk about what stronger alignment and governance would look like? I think even starting to socialize and have the conversations, if they're not being had, is critical. I think another piece that isn't just MarTech, but goes back even just within marketing and across, right, is how is work entering the team? How is workload being defined? How are we prioritizing work? How are trade-offs made? Like, do we have a good understanding of not that? And if not, to start to identify what could a clean intake system look like? How do we add prioritization so that our teams are not feeling completely inundated, right? That they are feeling like they're getting some wins and they know what they're working towards and what's most important. And role clarity. I know we talk about that. I know it's like the least attractive, sexy thing ever, but like who is leading what, right? Who is contributing? How are decisions getting made? Like, do we have a clear understanding of that? Or do we feel like when we look at our department that people are stepping over each other, right? Or that decisions are getting remade,
Hmm.
or, that things aren't happening on time, or something's coming in and then it goes into a black hole and comes back later as an escalation. Like, I think those are signs too that like there needs to be a closer look at role clarity and the intake piece of it and how work actually gets done. And oh, go ahead.
No, no, no. But I mean, so you got the intake and clarity of the roles, right? We were talking
Yes.
about, hey, do we have a
Yeah.
clear vision of what we want the patient journey to look like and be aligned through the departments? And I think those are are two great takeaways. And you maybe had like a third one. Did you have like a third item you wanted to add there?
I was just gonna say, I think to bring people together, like that sounds
Okay, right.
oversimplific.
So, but that kind of
But
feels
right.
like the first one, I guess, to get the conversation started around that.
Exactly. Yeah.
I think the one thing that's maybe I'm trying to take the perspective of, you know, an individual in a department, and we're kind of preaching to the choir where we know governance is so valuable, right?
Mhm.
And but governance for itself is, it's more of like a means to an end, right? And so how would I, if I'm seeing these symptoms, right, saying that, hey, decisions are being remade, you know, we seem to be
Mhm.
having wasting so much time, like how do we internally sell the value of good governance, right? How do we say, hey, you know what, this is why governance is important?
Yeah. I think that the identification of some of the challenges will be part of that, part of the acknowledgement
Right.
of things not working and needs to work better. But going back to what we were talking about earlier, I think starting out with something that is small, right?
Mm,
That's visible, but that's contained, that's cross functional, but something that could move forward with existing resources and where there can be quick wins is how to then show results. We did
right.
this way, and
Right.
I think part of it is efficiency metrics within a tool, but a big part of it too is just qualitative feedback from the teams, like morale and how's the team
Right.
feeling? Because it's really the team members that are trying to do this work that are struggling and feeling defeated and demoralized as well, right? So I think that's a really important metric to surface as well.
Well, I like this kind of point of view where it's not so because I think I could have come out of the conversation and say, oh, like, I gotta say, hey, we have to change the governance of our organization, but that sounds like that's something that's impossible to move or very slow,
Right.
right? But if we
It
say,
has
hey,
to,
let's just kind of scope it out, this one project, let's try a new approach to how we're making decisions in governance, and hey, let's
yeah,
let's have that prove, as you're saying, the momentum, right? Hey, that really
yes,
worked. Let's try another project. Oh, this is
yeah,
really, let's scale that slowly is
yeah.
probably the best way to approach it, right?
Yeah. Yes. And I'll just note that, like, I'm seeing shifts, right? Like, I'm seeing leaders of MarTech and operations being created. I'm seeing leaders of project management and process being created organizations. And I don't feel like I saw that
That's a
a
good
year,
sign.
right? I think that's a good sign that people are, the organizations are seeing the opportunity here.
All right. Well, that's great. Thank you so much, Teresa. That's all the time
Thank
we have
you.
for today. It was super interesting as usual. And so if people want to reach out to you, I guess they can go through LinkedIn or through Interpath Digital, I'm guessing.
Yeah. Yep. Yes, that would be perfect. You can find me on LinkedIn.
Excellent. So thank you so much for contributing to this episode. And I'll be seeing you in the future.
Yes. Thank you so much. This has been great.
Thanks, Teresa.
Thanks.